and it is noon, and so we're going to go ahead and get started. My name is Josh Nelson, and I am a CFP and the founder and CEO of Keystone Financial Services. And a lot of these webinars I give myself, but we have a guest speaker today, Ryann Little, who is a Medicare specialist. Yeah, this is a pretty hot topic. I can tell you that our average client is about 58, 59 years old. So for people who aren't drawing Medicare yet and aren't taking benefits, it's a hot topic as far as them starting to plan and wonder how their expenses are going to be flowing throughout retirement. So with that, I do want to throw out a couple of things. Again, we do have a Keys Financial Data handout in the handout section, so please keep an eye on that. Also, if you're watching on a recorded version, which is more likely the case, actually, we have a lot more people watch the recording as opposed to catching it live. And I think that's just a function of people being busy. We have a lot of busy people as clients, and people are able to access that wherever they are in the world and whatever time of day they want to. So keep an idea out that we do have the YouTube channel. If you go to our website, keystonefinancial.com, if you subscribe to our YouTube channel, you will get updates. Even if you don't know about a webinar happening, you can go to that YouTube channel and subscribe, and then you'll receive those updates as they happen. So today's presentation, we are recording it, and this will be available for you as well as anybody that you want to pass this along to. We always appreciate that, certainly to help get the word out. Almost all of our clients come as a result of working with us over the years, and then they pass on our name to other people. They say, you know what, you really should talk to these people at Keystone because your financial future is so important. And oftentimes the case, people aren't receiving good financial advice. They're not receiving good fiduciary level financial advice. And oftentimes what they're talking to is actually a product salesperson at the company that they're working with. So we want to make sure that that's not the case. We want to be the antidote to that, certainly, and make sure that people are getting the fiduciary level advice and getting comprehensive planning. So with that in mind, I'm actually going to hand it off here in just a second to Ryann Little. So Ryann actually is somebody I've known for several years. She's a Medicare specialist, and she has a company called youre Strategies that specializes in Medicare planning, and especially in the Medicare Supplement plans, understanding exactly how to sign up, and then understanding exactly how people should be structuring their plans from year to year. So with that, I'm going to go ahead and make Ryann the presenter, and then she can take it from here. Ryann, go ahead.
Fantastic. Thank you, Josh. I really appreciate being a part of this webinar, and I really appreciate being part of kind of the Keystone family. I think it really speaks volumes to how you operate as a business owner in the financial field, because as we all know, health insurance and health costs, especially in retirement, can really have a huge financial impact. So it's really important that people are aware of all the different choices and that they're able to plan effectively for their health needs. So that's where I step in. So I'm really happy to be a part of that. So again, hi everybody, my name is Ryann Little. I'm the founder of youre Insurance Strategies. We are a Medicare planning brokerage. So I am a licensed insurance professional, and I have carved out a little niche, I guess you should say, and I just handle Medicare. So I focus on everything Medicare related. That really gives me some really focused, specialized guidance for people. So moving a little bit on to what we do. So this is just a little bit about what we offer. I offer no obligation consultations for everything Medicare. So a little bit to tell you what I am as far as a broker and how I differ from other agents out there that may offer some Medicare plans. So being a broker, I contract with many different companies that offer all the different Medicare plans. I am not a captive agent. So a captive agent is somebody who contracts with maybe one or two insurance carriers. And of course, they're going to favor that particular insurance company and tell you that their plans are the best. Being that we're a broker and I contract with so many different companies, I can really sit down and learn about your specific needs and then connect you with the plans and the products that best fits your situation. So that's a great thing. Of course, everybody has probably heard by now about the kind of Medicare soup, alphabet soup per se. There's a lot of different parts that go into Medicare, and it's quite daunting, so that's why we help. So these are some common questions as far as Medicare goes, and I'm going to skim through these a little bit. So there's some misconceptions and some misunderstandings regarding Medicare and how it works and how it differs from other health insurance, whether that be individual health insurance or if you're getting insurance through an employer. People wonder if they're eligible if they have certain health conditions. Well, Medicare has a specific set of guidelines and a bunch of different rules and time frames as to when or if somebody can enroll into a certain Medicare plan. So that just is really, needs to be discovered. It's a person by person kind of situation. Guaranteed issue. What does guaranteed issue mean? So oftentimes when somebody is coming into Medicare, and that is obviously turning 65, or somebody can be eligible for Medicare if they are under the age of 65 and they are disabled. You have to be disabled for a minimum of 2 years to be eligible for Medicare. But guaranteed issue means is that when you come into Medicare for your first time, that means that any insurance plan, Medicare insurance plan, has to accept you. So they will issue your policy not based on your health history or any other questions. So you get to choose exactly what plan you want right out of the gate. We'll touch a little bit more on that in a minute. How much does Medicare cost? Well, that can vary from person to person depending on all the different choices. It's not a one-size-fits-all kind of setup. So it really just depends on which Medicare plan or plans work best for you. Another concern is that people hear a lot in the news that doctors don't accept Medicare. So will your doctor still take you when you change to Medicare? Oftentimes I see that if somebody has an established relationship with their current provider, then that provider, that doctor, will often grandfather them in and continue to take them when they're on Medicare. And that's generally speaking. It also depends on your certain Medicare plans that you choose. So obviously it's important to know which Medicare plans your doctor will accept moving forward, and that might help steer you into certain plans as well. So this next question is a big one I get. Should I go on my employer's retirement plan or my standalone Medicare? So this is something that I do often for people that are in the planning stages. Some of us are working a lot longer. They're working past age 65. So sometimes they need to be reviewing and be comparing if their employer's insurance plan is best for them or if they should kind of hop off and go to their individual Medicare plan. This is something that's important to take a look at because some employer plans are fantastic coverage and fantastic prices, but sometimes, and oftentimes actually I should say, individual Medicare plans are often better coverage and often lower cost. So that's a comparison that I'm happy to sit down and do with everybody. Will I be covered for foreign travel? This is a big question as well, because when people are planning retirement, everybody would like to go travel. Almost everybody, I would think, myself included. So you want to make sure that you're covered during foreign travel. So there are some certain plans that include some foreign travel coverage that needs to be discussed in our consultation as well.
Hey Ryan, this is Josh. One question that we do have sometimes from retirees is oftentimes they will have, if they were with a company for a long time, they may have some eligibility for some type of retiree health insurance coverage, or if they were a government employee in Colorado, a para employee. How does that coordinate? How does that tend to work as people are hitting age 65 and they stop working?
Yeah, that's a great question, Josh. So as far as those plans go, those retiree plans go for these larger companies, and I have a lot of clients that are either state employees, like you say, or other type of government employees, or just, coming from large corporations that offer these retiree plans. So again, that's kind of a sit down comparison that we need to do, because what is happening is that the employer, whether it be the state, the government, or a large corporation, are offering retiree plans because that company has contracted with a certain carrier that offers a type of retiree plan, Medicare retiree plan, and most of them are structured just like a certain Medicare standalone plan that I offer, and that is offered to everybody else. It's just administered through that corporation. So sometimes they're great plans, but again, Medicare is not a one-size-fits-all kind of setup. So if your employer is kind of guiding you into a retiree plan, just know that it is your right to explore your other options. And oftentimes a corporation or your employer will offer some kind of reimbursement towards your own Medicare plans. So again, it's just all about comparing and knowing that you have some other choices to go with. Hope that helps answer that question.
Yes, yeah, thank you.
Great. So here's a couple Medicare basics that we'll go through really quick. This is just kind of breaking down what original Medicare is. So if somebody has just original Medicare, you've heard of Part A and Part B, and here's just a quick review. Part A is hospital coverage, so that's when you are admitted into the hospital. This is generally a no cost for most people if you've worked your 40 quarters in your lifetime and paid into taxes. Part B is your medical coverage. So Part B medical is everything that is just a regular doctor's visit, some testing, diagnostics, stuff like that. The base monthly premium this year, and this changes year by year, this year it's $135.50. There's a little star next to that because approximately 5% of people will pay some income-related surcharges. It's called IRMA. And that is billed by Social Security. So Part B, the way you pay this is through Social Security. So for those retirees that are already drawing their Social Security retirement benefits, their Part B premium, that's $135, will be automatically deducted from their benefit check. So you really won't even miss it. If you are somebody that is not drawing Social Security retirement benefits yet, and just a little plug in there, you should be talking to Josh about when the ideal, time to draw your retirement benefits is. So for those that are not quite yet drawing those benefits, you will be billed on a quarterly basis from Social Security. So you'll get four bills a year from Social Security to pay your Part B. So when you're turning 65 and coming into Medicare, there's a 7-month time frame, and that starts 3 months ahead of your birth month, and then it ends 3 months after your birth month. So that's kind of your window to get things rolling, get things in place. And you apply for A and B through Social Security. It takes about 10 minutes to apply online, or you can go down in person to the local Social Security office. If you are over 65 and you still continue to work, there's two things here. So it's important to know that you don't need to sign up for Part B if you are covered on an employer group plan and over the age of 65. Likely you will automatically get Part A through Social Security, but you don't need to pay for Part B if you already have some health coverage. So if you're over 65, you need to sign up within 6 months of losing or retiring from your employer and losing that health coverage. So you must have these two pieces in place before you move on to select some type of additional Medicare plan, which is a Medicare Advantage plan or a supplement, and we'll talk a little bit about that in just a second.
Hey, Ryan, Josh again. Hey, just to be clear, as far as sign up, because I know a lot of people get confused about this, especially if they are still working. So if they're still at an employer and they're receiving their normal health coverage through that employer, are they required to sign up for Part A or any of the parts then of Medicare because they've turned 65, or would they wait until they retired?
That's a great question. So They're not required. So there are certain circumstances where people would even refuse to sign up for Part A. If you are past the age of 65 and you're drawing Social Security retirement benefits, they're going to Social Security will automatically sign you up for Part A. But if you have an HSA, then you want to refuse Part A because there are some tax implications to contributing to your HSA while on any part of Medicare. Furthermore, so if you do not have an HSA and you continue working past the age of 65, having Part A is no big deal. You can keep that, and it really does not affect your current, say, your employer coverage. But you don't want to enroll into Part B yet because you're paying $135 per month for that Part B coverage that is kind of a waste, because if you have your group employer coverage, that is your primary coverage, and then Medicare Part A and B is your secondary. Well, I can tell you that most oftentimes your primary employer group coverage is going to pay all the bills, and it's really, your Medicare is not going to come into play. So if you are still covered under an employer group plan, there's no reason to pay for Part B. Does that clarify things for you?
It is, yeah, and it's interesting. I've had a couple of clients where their employer actually requires them to sign up for Part A at 65, even though they're still working for the company. I'm sure probably to diminish their costs and their plans.
Yeah, and it's interesting. I work with a lot of HR people in different corporations to just try to educate them a little better, because Medicare is kind of a confusing animal. It's completely different than employer group plans that they're used to dealing with all the time. So oftentimes they're trying to guide their people as best as they can, but sometimes there's some misinformation out there. So yeah, I'm happy to help educate that as well. So it is interesting what they require. It's actually in the employer's best interest if their aging employees are coming off of those group employer plans or even off of those retiree plans, because it saves the employer money, and then the employee is often getting, like I said, better coverage at a lower cost. So it's kind of a win-win for everybody, but oftentimes that is kind of an unknown thing until they get educated on that. So
okay, thank you.
Yeah, sure. So here's some original costs in Medicare for 2019. And again, these numbers vary a little bit year by year. So if somebody were to say that they're just on original Medicare, this is what their costs would look like. Obviously, we mentioned that Part A is hospital coverage. So if you are admitted into the hospital, this is the deductible per occurrence that you would have to pay the hospital directly if you were only on original Medicare. So every time you get it, every time you go into the hospital, you have to come out of pocket $1,300, and that's per occurrence. So the copays, these are daily copays. So if you're sitting in the hospital up to 60 days, you don't have to pay anything out of pocket just for being in the hospital. But if you're sitting in the hospital past 60 days up to 90 days, that $341 is a per day charge. So if you're admitted into the hospital, you're coming out of pocket $1,364, and then every day past 60 days, you're paying $341 per day, and then it jumps up again if you're sitting in the hospital for a little longer, past 90 days up to 150. That $682 is also a per day charge. So that's a pretty hefty bill, just being on original Medicare going into the hospital. And this is just being in the hospital. This does not include any of the diagnostics, testing, services that you'd get, likely being in the hospital as well. Skilled nursing would come into play. There's some different guidelines surrounding skilled nursing that we can go over on a case-by-case basis, but it's generally comes into play after 3 days being admitted into the hospital, and that's a per day charge past day 20 up to day 100 of $170. So that's original Medicare Part A. Original Medicare Part B, like I mentioned, is everything medical care. So those are your regular doctor visits, not being admitted into the hospital. Part B has an annual deductible of $185, which is not terrible for an annual deductible. So beyond what I just mentioned from Part A and Part B, those out-of-pocket per occurrence charges or per day copays and this annual deductible, whatever is going on with somebody health-wise, Medicare generally pays about 80% of all the medically necessary claims from Part A and Part B. So that leaves somebody with 20% of the bill if they're only on original Medicare. And if you're in the hospital going through a bad accident or a bad illness, 20% of a bill can be a pretty hefty charge. So that's when somebody says that they want to minimize those out-of-pocket costs. And their choices here are to, one, go with a Part C Advantage plan, or they can choose a Medicare Supplement. And I'll talk a little bit about the differences. So Advantage plans are also known as Part C. This becomes your primary insurance. So these, this insurance are those companies that you hear often in the Colorado area are United Healthcare, Humana, Aetna, Blue Cross Blue Shield a little bit is there as well. So these plans are really attractive to people because they have a very low or zero monthly premium. Often drug coverage are included in these plans. There's some possible additional benefits included. Sometimes there's dental, vision, sometimes health club access. I'm sure some people have heard of silver sneakers. These are guaranteed issues, so you don't have to answer any health questions or be accepted per se into the plan. These are your HMO or PPO networks, so you need to stay within a network of doctors or providers, generally speaking. These plans are an annual contract, so January through December. So the changes and cancellations with these plans can only occur during certain times of the year, and that's usually speaking about Medicare open enrollment, and that is October 15th through December 7th of every year. So beyond they're very attractive because they have that low or zero monthly premium. However, on the back end, if you're somebody that has some health concerns and you need to see the doctor or hospital on a regular basis, you're going to be paying copays and deductibles for almost every service with these plans. So those copays and deductibles can really add up. Just to give you an example, a plan might charge $35 every time you go see your primary care specialist, and then a $50 copay for every time you see a different specialist. So those can really add up. Now, Medicare does cap those out-of-pocket costs by way of copays and deductibles for these plans, and that cap is $6,700 for in-network care. So if you were to be experiencing something difficult health-wise and you really had to be in the hospital and or the doctor a lot during the year and paying a lot of copays and deductibles for different services, then the most you would pay under one of these plans is $6,700 out of pocket. After that $6,700 out of pocket, they would cover you at 100% as long as it's Medicare-related claims. So these plans are fantastic because it does have that drug coverage included, like I mentioned. However, you must abide by their formulary, and a formulary is just a list of covered medications. So if you are somebody that has maybe a medication that is not just a common generic, if your medication is not on their list of covered medications, then you will be responsible for the full retail cost of that medication. So that's the catch there. Doctors within these networks, they must seek approval from the carrier for certain services. So to give you an example, if say Josh was on one of these plans and he needed a CAT scan, the doctor would call up the plan company and say, you know, I'd like to give Josh a CAT scan. And the company may say, well, let's try this test or this test before we do a CAT scan. And really that's to save money. Sometimes it's not a big deal, but sometimes it can, cause a little bit of a headache.
So Ryan, that it could be appropriate that maybe a Medicare Advantage plan could be appropriate for somebody who, at least up until this point, they're under no medications. All they really do is go for their annual checkup and they have no health concerns. Then Medicare Advantage, would that be safe to say that could be a good type of plan for them?
It would be, but there, like I mentioned at the beginning, Medicare has some really strict guidelines and rules surrounding when or if somebody can switch plans. So that's a great question. I'm really glad you brought that up, Josh, because those plans, that's kind of what people think their train of thought is when they're comparing their different choices coming into Medicare. And they may think, well, maybe I will start with one of these Part C Advantage plans, and then if I start experiencing some health concerns, I'll just go to a different plan where I'm not experiencing all those copays and deductibles. Well, that's not necessarily what you can do, because these Part C Advantage plans, they're guaranteed issue with no health questions. However, the other choice that we'll talk about in a minute, with a Medicare Supplement, you will have to pass medical underwriting if you are past your guaranteed issue timeframes. So if you're experiencing some health concerns, then a Medicare Supplement company can actually deny you, and you would be essentially stuck, quote unquote, stuck on this Advantage plan. Okay, so it's important to know your choices up front. If you're somebody that is healthy now, but maybe you have a history of, certain cancers or certain heart diseases that, has just really hit everybody else in your family kind of hard, and you're kind of planning ahead, it might be in your best interest to maybe choose something besides an Advantage plan, because as we all know, health can be funny, and one minute we can be just dandy fine and something, bad can happen the next day. So it's kind of the insurance gamble.
Great. Yeah, I think that's a good point in that it could save people money up front, say if they're really healthy, but then health concerns come up, it actually could end up, because of the out-of-pockets, right? It could end up costing them far more in the long run.
Exactly. That $6,700 annual cap, and I say annual cap because that's exactly what it is. So if somebody is on an Advantage plan year after year, they could potentially be out of pocket $6,700 every single year, because it starts over every January 1st. Yeah, that's a big number. So,
all right.
So Medicare Supplement or Medigap plan, those terms are interchanged. That this is your other choice as far as Medicare plans. So these plans, your primary insurance stays original Medicare, and then your supplement becomes your secondary insurance. These are all standardized, so they're private insurance plans offered by several different companies. Here's another alphabet soup for you. So all of these letters represent different Medicare Supplement plans. Most of these are offered in every state, with the exception of a couple in certain states. But when I say they're standardized, that means that they are standardized by the government. So that means whatever company is offering a plan A, let's say, every company has to offer the same exact coverage for plan A. So no matter what company you go with, the coverage is going to be identical. The difference is going to be price and maybe a couple little extra perks built into that Medicare Supplement plan. So just a quick overview about Medicare Supplement plans and how they differ from those Advantage plans. Medicare Supplement plans, you don't have to abide by a network, so you can see any provider in the United States that accept Medicare. And if they accept Medicare, that means that they accept Medicare assignment. Those are the key words. As far as foreign travel, there are some foreign travel emergency coverage with some plans. It's usually a very low deductible that you have to pay. It's about $250. And then it's a cost share basis up to $50,000. that you would have access to if something should happen, basically to treat you acutely and then get you back to the US where your full Medicare would kick in. There are no referrals required to see specialists. So you can really just go, again, to anybody that accepts Medicare assignment. No approvals needed for services. So again, back to the Josh example, if Josh needed a CAT scan done, his doctor can go ahead and do it without needing approval from an insurance company to perform that service. Here's kind of the downside or the difference from a Medicare supplement to an Advantage plan. These do have higher monthly premiums. However, even though they have monthly premiums, some of the plans have very, very minimal copays and deductibles. So you're more effectively able to plan your annual budget as far as healthcare coverage goes. With these plans, with Medicare Supplement plans, you have to purchase a standalone prescription drug plan, a Part D plan for your drug coverage. So in essence, it's a whole nother insurance policy, but the beauty of this is that we're able to tailor your prescription drug coverage specific to your medications and your pharmacy. And this is where I'm really able to save some clients money. And this is really important to review. So if those of you who may already be on Medicare or know somebody who is on Medicare, it's really important to review this every year, your prescription drug coverage, because those plans change every year and people's medications might change every year. And those costs can really vary. And I'll give you a quick example of a client last year. He's been on a certain plan for a couple years. It's worked great for him, but the plan changed a little bit. His meds did not change. And if we did not move him to a different prescription drug plan for the following year, he would have unnecessarily paid about $3,000 more that year just because his plan had changed a little bit and his medications had changed, his coverage has changed. So it's really important to review that all the time. For Medicare supplements, the claims process is very seamless, so there's no balance billing from a doctor's office. So, with certain plans. So the plan changes anytime when you qualify. So this is another little aspect that I offer my clients, is that I want to review your Medicare supplement policy at least every couple of years, because naturally it's insurance, so the costs are going to increase little by little every year. But if you've endured a couple price increases, and if there's another Medicare supplement plan that is identical coverage but at a lower cost, then we're gonna switch you over to that plan as long as you can qualify through health underwriting. So that's important to stay on top of. Really, my goal is to make sure that my clients are always on the best plan for their needs at the lowest cost. So that's really what we strive for, because nobody wants to waste money, especially with insurance and their health coverage. So a little bit about prescription drug coverage. After enrolling into Medicare A and B, you have to have some type of prescription drug coverage, or Social Security is going to hit you with a penalty. And that penalty is a 1% penalty for every month that you did not have coverage that you were eligible to have coverage. So if there's anybody on the call that is possibly a veteran, that wouldn't apply to you, because veterans have prescription drug coverage through the VA. So just keep that in mind. Again, this is included in some Advantage plans, but you must abide by their formulary, so your medications have to be on their list. If you have original Medicare and a supplement, you can enroll into a standalone prescription drug plan, and we can tailor that plan to your specific prescriptions. So for those that are not on prescriptions, I always just recommend to enroll into the most cheapest, low-cost prescription drug plan that's available for your area. To give you an example, in Colorado this year, it's about $16 per month. So even if you're not on prescriptions at the moment, it's in your best interest to go ahead and enroll into that cheap plan just to avoid that 1% penalty down the road. So again, donut hole and coverage gap, this is something that I'm sure a lot of people have heard about, and that's kind of on a case-by-case basis. So if you're on some higher cost medications, the donut hole or coverage gap might apply to you, but that's something that we can go through, together. So beyond Medicare, not all health-related expenses are covered, and that's something that sometimes people are very surprised about. A couple of examples of that is dental, vision, and hearing coverage is not included in Medicare. Short-term and long-term care is not included in Medicare, life insurance, and final expense insurance. So you definitely want to seek out some additional coverage when it comes to those areas. So that kind of concludes, that was a very quick overview of Medicare and what my business offers and what we do. Here's my contact information. Again, I offer free consultations or reviews to go through and help somebody select their Medicare plans when they're just coming into Medicare, but also those who are already on Medicare. I'm happy to do those reviews and make sure they're on the most cost-effective plans for their needs. So yeah, that concludes everything. I'm open to questions. If you'd like to email me, call me anytime. And Josh is great about connecting his clients when they have questions as well.
Sure, Ryan, thank you. And one thing that people do have the ability to do right now is if you want to plug in any questions that you have into the questions box or the chat box, certainly I can relay those over to Ryan as we're going here. As we're doing that, as those are compiling, Ryan, as far as time frames, what I've experienced with clients is they start getting inundated with stuff showing up in their mailbox after they turn 64. It seems like that's when it happens.
Yes.
When people are getting that, I mean, if they're using somebody like you and they're doing the consultation, can they kind of ignore all that stuff? Because people, more than anything, I think they just get overwhelmed with the amount of information that's hitting them.
Absolutely. Yes. When you're coming up on that 65-year mark, you're right. And often that's the sigh of relief that I hear from my clients when I tell them they can ignore all of that stuff after we've spoken and kind of narrowed down their choices, because it's extremely overwhelming. And I can tell you that 90% of that mail that you're getting from different companies wanting you to enroll into certain plans are generally those Advantage plans. And the reason for that is because those Advantage plans are the money makers for these insurance companies. And again, those Advantage plans are really great for certain people, but they're not fantastic for everybody. So, but unfortunately, that's what all the marketing is really geared toward. So you're probably seeing TV commercials and then addition to the stacks and stacks of mail. So yes, I can show you all the different choices, and then everybody can start just recycling all of that junk mail.
Yeah, and that's a really good point too. So just because you've used a certain insurance company, and I would think that a lot of people would just say, I'm just going to try to keep it simple. I'm going to call United Healthcare or whoever the company is. So people shouldn't just assume that the person they talk to on the phone is going to be steering them in the right direction, right? It could be that if the Medicare Advantage plan is what their main product is, then people could be swayed that direction. Is that fair to say?
That is very fair to say, and that's what often happens. And then those people that, enroll into an Advantage plan, really not understanding the pros and cons of that plan, it breaks my heart because, a year later they're calling me when they're experiencing some out-of-pocket copays and higher costs. But then at that point, they may not be eligible to get to a Medicare Supplement plan because they can't pass medical underwriting. So there's still some options for those people. I can help find the best. However, yeah, going that other direction is difficult. So it is not always the best choice to go with the company that you've heard most about. And that also happens in employer settings too. So maybe your employer has offered, let's say, for example, United Healthcare employer plans for many years, and you're comfortable with that. Well, they might offer a United Healthcare retiree plan. Well, again, it's not a one size fits all kind of situation. So it's good to review.
Sure. Yeah, and I've heard that from people too, is that they were even eligible for some type of employer retiree coverage, and then when it came to doing the analysis, they actually found that it was a better fit for them and less expensive to go with to not use the employer plan. In some cases, there wasn't much of a subsidy from the company to begin with. So I think it's my take from talking to a lot of people about this is that people just get overwhelmed, and when we get overwhelmed, we try to simplify things, and sometimes that's not always the best thing, right? It could lead us to a plan that doesn't make sense for us.
Absolutely. Yep, I'm happy to.
As far as timelines, it sounds like, because again, there's a lot of confusion around this as far as how soon people should start thinking about this, or how soon they need to log into Social Security and sign up for Medicare. Can you review those again, just for people, maybe they've turned 64, they know that this is coming up. What are the key time frames or dates that they need to be concerned about?
Absolutely. So let's first talk about those people who are not drawing Social Security retirement benefits quite yet. So if they haven't turned those retirement benefits on, they will need to start the process of enrolling into Part A and Part B about 2 to 3 months ahead of their birthday month. And they can do that by going to Social Security online. It's ssa.gov. Or they can go to their Social Security office and get the application and start the process. And then within 2 to 3 weeks, I say is the average turnaround, they will receive their red, white, and blue Medicare card in the mail. And then at that point, that gives us the ability to sit down and really start looking at the different plans and the different quotes and the different coverages that are available to that person. And I would say, everybody's a little bit different as far as time frames and stuff, but I say ideally that we would want a plan in place or nailed down and the process started for an Advantage plan or a Medicare Supplement about a month away from the start date. So generally speaking, your A and B and whatever additional plan you choose, whether that be an Advantage plan or a Medicare Supplement, is going to start on the first day of the month that you turn 65. So if you turn 65 June 15th, then your start date will be June 1st for your Medicare stuff. So again, about 2 to 3 months ahead, start getting your A and B in place through Social Security. And then as soon as you get that red, white, and blue confirmation or that card in the mail, that's when we want to sit down and start going through all the different plan choices and getting that ball rolling as well. And I help with that whole process from all the quoting, and then I do help with the enrollment, and I track that through my different portals online to make sure everything goes right. So really my clients are kind of hands off. They don't need to be calling different companies on the phone, be doing a lot of paperwork. I handle all of that for them.
Yeah, and Social Security is a big topic that people will ask us about as well, and these kind of fit hand in hand. They're around the same time frame, but a lot of times people are wondering when the break-even point is for them as far as what age should they draw. And oftentimes, unless people don't have a lot of longevity in their family, a lot of times people are waiting beyond age 65 to sign up for Social Security benefits. So that means at least a lot of the folks that we're talking to, because they haven't signed up for Social Security, they do have to go in proactively and sign up for Medicare, correct?
Correct. Yep. If they have not started their retirement benefits yet, they have to get that process going. If they are on Social Security retirement benefits already, when they're coming into age 65, Social Security will automatically process A and B and spit that card out into the mail for them automatically, and they'll get that about 2 to 3 months ahead of their 65th birthday.
Okay. One question that came through here, it says, I'm overwhelmed by all this. What are Ryan's costs, or is this included with my services with Keystone Financial? And I can answer that one, that there's no cost to do that analysis with you, and even if you help them set up a plan and get it all in place, right? There's no cost to them at all.
That's correct. So my clients never pay me, so I don't charge for my services, and my clients also never pay more for those specific plans by working through me to get those plans. So really it's kind of a win-win for everybody. I make my living and make my money through all the different companies I contract with. So if my client that I'm sitting down with happens to enroll into one of the plans that I represent and I sell, then I will make some commission off of that sale.
Right, and just to be clear, then that does not cost them any more than, say, if they went directly to United Healthcare themselves, right? That
That's
makes
exactly
no difference as far as the premium. Yeah, exactly.
Those prices are controlled by each individual state Department of Insurance, and some of it is federal as well. So yeah, there's no money being exchanged from my clients to me, and they don't pay extra for those plans.
Sure. Yeah, and just to be clear too, Ryann and I, we're business partners from the standpoint that we're trying to help each other's clients, but we get paid nothing from her and vice versa. So this is one of those things that we're basically just trying to find a solution for our clients that are, that would save them a lot of time, because again, that's probably the scarcest commodity among all of us, is our time, right?
Absolutely. So, yeah, time and energy is a big thing. And I am definitely not an expert in the financial field as far as investing and retirement strategies. So that's where Josh is the expert. And, I have tackled the Medicare field. So that's where we kind of team up, and we just make sure that the clients at Keystone are taken care of well as far as planning ahead.
Sure. Yeah, and as we wrap up too, that is one thing that we're always focused on, is that we really are here for comprehensive financial planning. And that's kind of a lofty term, but it basically means that we cover everything. We're able to either help people directly, whether it be Social Security, retirement planning, estate planning, but oftentimes we do need to bring in subject matter experts, especially in something like this with Medicare. And as everybody's learned throughout the presentation, there's a lot of gotchas. There's a lot of things that you can mess up on, right? If you don't understand. And of course, nobody knowingly, wants to make a mistake with their finances. And so that's one of those things we want to pull in these subject matter experts as needed to make sure that we don't have some unintended consequence.
Absolutely. And to that attendee that said that they're pretty overwhelmed with all this, I understand, and this is a really quick overview of the big picture of Medicare. But when I sit down to do a consultation with somebody, I'm asking them a few important questions about their life, and then I can kind of direct them and give them little bite-sized pieces and really break it down in a more clear fashion for their specific situation. So.
And that applies even if they're already drawing Medicare, correct?
Absolutely. I would really love to do those reviews. I often uncover really significant savings for people that are already on Medicare. I just did a couple cases for a couple people last month. They were overpaying by $120 a piece per month for their Medicare Supplement. So really, we got them the identical type of plan. So their coverage didn't change one bit, but their price dropped by $120 a month.
Wow.
Yeah.
That's a lot.
It is.
All right. One question that came up too is as far as states. And we're primarily based here in Colorado, but we have clients that are all over the country, and I know a couple that have dialed in live here that are outside of the area. How can they? Which states do you actually cover? And if they're not in one of those states, then how can we get them help?
Absolutely. So regardless of what state somebody is in, I'm able to at least answer some general questions, and then I can get them in touch with some professionals that do something similar to what I do in those states if needed. But beyond that, I am licensed in a few different states. Those states include Colorado, of course, New Mexico, North Carolina, Mississippi, Tennessee, and then Florida and Georgia, South Carolina are in the works. And I'll probably be adding a little bit more as we go. So really, if somebody has some questions from a different state, I can direct them one way or another to get some solutions for them.
Sure, or at least to be able to steer them towards somebody like you,
Exactly.
even if you can't help them directly. Yeah, the biggest thing is we want to make sure that people don't end up with maybe they're not scammed necessarily, but we want to make sure that they don't end up talking to somebody that's not working in their best interest.
Absolutely.
All right. Very good. Well, I don't see any other questions in the queue. Any last thoughts, Ryann? Other stuff that we should make sure we talk about before we wrap up?
No, I think we've probably confused people just enough.
Yeah. Well, it's a confusing it's a confusing area of finance. That's for sure.
Yeah, it is. But I'm here. No question is small or silly. So, yeah, I'm here and willing to help.
Great. All right, sounds good. Well, thank you, everybody who dialed in, and thank you for everybody who watched the recorded version. Again, certainly pass this on to anybody that you think it would be helpful. And even if you're watching the recorded version, certainly Ryann and myself too. My email address isn't on the screen right now, but it's just josh@keystonefinancial.com. So you can field those questions to either one of us, and it could be even not for you, but it could be from a family member, a coworker, could be somebody else that you care about that you know really should be learning more about this and checking out the types of benefits that they need to be concerned about.
Absolutely. Thank you, everybody, for your time. I appreciate it. And thank you, Josh.
All right. Yep. Thanks, Ryann. Take care.